I'm Simon Wade, a student of physical therapy. Today we're going to talk about our plan of care for Mr. Webster, 63-year-old male with diabetes, presenting with healing wound ulcer in his left foot, some fall risk, tachycardia, and a few other things. So one of the first things that comes to my attention that I'm going to work on in this initial encounter with the patient is the tender and to the touch and swollen left calf. I have a concern for a DVT, so I'm going to perform Wells criteria, and I'll make sure that information makes it to his primary care, as he may need further D-dimer testing, ultrasound imaging, and possibly some anticoagulation medication as results show. And then moving to the left toe ulceration, which I can work on with the patient. Based on the information given so far that the foot is dry and scaly, I suspect that there is a possible arterial insufficiency. So I want to perform some tests to determine this. I would start with an ABI. If the ABI comes back higher than 1.1 because of hyperglycemic calcification. I have other tests I can perform. I could do a ruber of dependency, looking if the patient has pallor in less than 25 seconds. That would indicate a severe arterial insufficiency. I can also perform a capillary refill. Based on these results, I might find that compression is contraindicated for the edema in this wound. I would make sure to educate the patient in this. And moving into the wound management, I would want to use a hydrogel and promote a moist wound environment and dress it. This patient, being homeless, might not have very frequent medical encounters, so I'm probably going to use autolytic debridement, as this is an easier take-home method. I will educate the patient on signs and symptoms of an infection to look for in the wound, normal and abnormal peri-wound characteristics, things that he can keep an eye on, as he's going to have to be pretty self-sufficient here, and he's going to need to know when he needs to reach out to his medical staff that he has. Like mentioned earlier, I'm going to let the patient know that to offload this limb as much as possible and minimize compression. I'm going to make sure the patient is not wearing tight footwear or compression stockings in that left lower extremity. Another thing that came to my mind is the patient's heart rate and respiratory rate are quite elevated, and it was noted that they have a sinus tachycardia. I would want to have a cardiologist see this patient before I move forward into cardiovascular intense exercise. But if that passes and the referral comes back to me, I would definitely want to work on some cardiovascular endurance type of exercise with this patient, get them on a bike, get them walking and moving. Actually prefer a bike to avoid the compression to that left lower extremity. And then in terms of the diabetes, I really want to do what I can to make this patient able to do as much of their self-care as possible. I want to educate them on signs and symptoms of hypo and hyperglycemia, noting that the patient, if they find themselves increased in urination and increase in thirst, these can be signs that they are hyperglycemic, indicating he might be needing some insulin. On the other end, let him know that if he finds himself with blurry visions or headaches, he might be hypoglycemic, which can be bad as well. Definitely, as mentioned by other classmates, would want to refer out for diabetic management, as it seems he's not doing well currently in managing this, hence the admission. Next thing, getting pretty specific here to PT, is it's noted that he has a high fall risk. I'd want to perform a Berg balance scale assessment with this patient. This is going to determine if he is independent or if he needs assistance. Based on the results of the Berg screen, I might give this patient a front-wheeled walker to minimize the fall risk, or if he does decent on the screen, maybe he can do fine with a cane. That's going to depend on the results. Also, based on what areas I see he has difficulty on during that screening, I'm going to turn some of those tests into interventions for him, things like semi-tandem balancing. We're going to work on tandem balancing. I want to see him standing with his eyes closed versus eyes open. We're going to practice this, and then alternating foot elevations to a stool so he can practice his single leg stance. Assuming that he doesn't meet independence from that from that test, I would have him practice balance with his walker. And then the last thing to work on here is it's mentioned he's incurring some mental health challenges and depression through the deterioration of his health and all this, I would definitely want to refer out to get him the help he needs there. I do know this patient is going to have limited access to healthcare. It sounds like the nurse at his homeless shelter is his biggest resource, so I'd want to be in touch with that practitioner as much as possible so that I could give my findings to that healthcare provider and we can really work together with Mr. Webster, I believe his last name was. Yes, Webster. And that concludes our plan of care for physical therapy.